Depression is a common mental health condition that can be chronic and progressive. Welcome to Channel Health and Alerts. It's a word we hear often, a shadow that touches countless lives. It's more than just feeling down. It's a serious illness that impacts every aspect of our being, our thoughts, our feelings, and often unnoticed, our physical selves. We often associate depression with deep sadness, a loss of interest in life, and overwhelming fatigue. But its reach extends far beyond the mind. Depression whispers through the very pathways of our bodies, manifesting in ways we might not always recognize. It's easy to mistake these physical symptoms for something else, a stressful week, a lack of sleep, or an oncoming flu. But when these discomforts linger, when they become woven into the fabric of our days, they might be telling us a different story, a story of a mind struggling and a body caught in the crossfire. Understanding the physical language of depression is not about self-diagnosing. It's about recognizing when our bodies are sending out distress signals, urging us to seek help, to understand that our pain is real and that we deserve support and healing. Our bodies have a way of speaking to us, even when words fail. They signal distress through a myriad of sensations, aches, and discomforts. Often these physical symptoms are our first clues that something deeper might be amiss. When these sensations persist, and especially when they accompany low mood, fatigue, or a loss of interest in things we once enjoyed, they might be pointing towards depression. These physical manifestations of depression can vary greatly from person to person. Some experience digestive issues like nausea, constipation, or diarrhea. Others feel a constant ache in their muscles or a tightness in their chest that makes it hard to breathe. Sleep, a sanctuary for our bodies and minds, often becomes elusive when depression takes hold. Insomnia might leave us staring at the ceiling, our thoughts racing long into the night. On the other hand, some of us might find ourselves trapped in an exhausting cycle of oversleeping, seeking refuge from the world in an excess of slumber. The heart, that symbol of emotion, often mirrors the turmoil within. Depression can make its presence known through a racing heart, palpitations, or a tightness in the chest that mimics the feeling of a heart attack. Breathing can become shallow and rapid, leaving us gasping for air, our bodies mirroring the anxiety and fear that grip us internally. Headaches, often relentless and debilitating, can become a regular companion for those grappling with depression. These headaches are not merely a result of stress. They are deeply intertwined with the chemical imbalances that characterize this complex illness. Similarly, muscle aches, particularly in the back, neck, and shoulders, are common complaints. Our bodies, perpetually tense, reflect the inner turmoil we carry. To understand the link between our physical and mental states, we need to look at the intricate workings of our brains. Neurotransmitters, the chemical messengers that carry signals between nerve cells, play a pivotal role in regulating our mood, sleep, appetite, and even our perception of pain. When we experience depression, the delicate balance of these neurotransmitters, particularly serotonin, dopamine, and norepinephrine, is disrupted. This disruption affects not only our emotional well-being, but also the way our bodies function. Serotonin, often referred to as the feel-good hormone, plays a crucial role in regulating mood, sleep, and appetite. Low levels of serotonin have been linked to sleep disturbances, low energy levels, changes in appetite, and increased pain perception. Dopamine, associated with pleasure and reward, is also implicated in depression. When dopamine levels are low, we experience a lack of motivation, difficulty concentrating, and a diminished sense of pleasure in activities we once enjoyed. Norepinephrine, involved in the body's stress response, is responsible for alertness and focus. Imbalances in norepinephrine can contribute to anxiety, restlessness, and difficulty concentrating, further exacerbating the physical symptoms of depression. Recognizing the physical manifestations of depression is crucial for several reasons. Firstly, it can help us differentiate between depression and other medical conditions that might share similar symptoms. For instance, unexplained fatigue could be a sign of depression, but it could also indicate a thyroid problem or vitamin deficiency. Secondly, acknowledging the physical toll of depression validates our experience. Sexual problems. If you're depressed, you might lose your interest in sex. Some prescription drugs that treat depression can also take away your drive and affect performance. Talk to your doctor about your medicine options. Agitated and restlessness. Sleep problems or other depression symptoms can make you feel this way. Men are more likely than women to be irritable when they're depressed. It reminds us that this is not just all in our heads, but a real illness that impacts our entire being. This understanding can be empowering, encouraging us to seek help and support. Thirdly, understanding the interconnectedness of our physical and mental health paves the way for a more holistic approach to treatment. Well-informed people are more likely to survive longer and have a better quality of life than uninformed ones. Addressing the physical symptoms of depression alongside the emotional and cognitive aspects can lead to more effective and sustainable healing. Reset Health, Reset Life, subscribe and share to care.